Hello everyone, welcome to VIJAYASREE e-tutorial. I'm Amiya, 2019 batch. Today we will be discussing about femoral triangle. So let's move on to the topic. Femoral triangle is a very common university question. Its boundaries, roof, floor, contents and clinical correlation. ഇത്രയുമാണ് ഈ വീഡിയോയിൽ നമ്മൾ ഇന്ന് കവർ ചെയ്യാൻ പോകുന്നത്. Femoral triangle, it is a triangular depression on the front of the upper one-third of thigh situated below inguinal ligament. As you can see in the figure, its apex is directed downwards. Moving on to the boundaries. Lateral boundary is formed by medial border of sartorius, the longest muscle in the body. Medial boundary is formed by medial border of adductor longus. Base is formed by inguinal ligament and apex is formed by meeting point of its lateral and medial boundaries, that is adductor longus and sartorius. Next we have the floor. 4 muscles ആണ് femoral triangle floor form ചെയ്യുന്നത്. From lateral to medial side, they are iliacus, psoas major tendon, pectineus and adductor longus. Next we have the roof. Roof is formed by fascia lata having saphenous opening. Fascia lata is a deep fascia of thigh and saphenous opening is one of its modifications. ഈ റൂഫിൻ്റെ മേലെ നമുക്ക് സൂപ്പർഫിഷ്യൽ ഫേഷ്യ ഉണ്ട്. സൂപ്പർഫിഷ്യൽ ഫേഷ്യനെ കവർ ചെയ്തുകൊണ്ട് സ്കിൻ ഉണ്ട്. സൂപ്പർഫിഷ്യൽ ഫേഷ്യ ഓവർലൈങ് ദ റൂഫ്, ഇറ്റ് കണ്ടെയ്ൻസ് സൂപ്പർഫിഷ്യൽ ബ്രാഞ്ചസ് ഓഫ് femoral artery and accompanying veins, upper part of great saphenous vein, superficial inguinal lymph nodes, femoral branch of genitofemoral nerve and branches of ilioinguinal nerve. Moving on to the main contents of femoral triangle. First we have femoral artery and its branches, femoral vein and its tributaries, femoral nerve, deep inguinal lymph nodes and lateral cutaneous nerve of thigh. In addition to this, it also contains femoral branch of genitofemoral nerve and fibrofatty tissue. ഇനി നമുക്ക് ഇതിൻ്റെ ഓരോ കണ്ടൻസും കുറച്ച് വിശദമായിട്ട് നോക്കാം. First we have femoral artery. As we can see in the figure, femoral artery, it is a continuation of external iliac artery and it enters the femoral triangle behind inguinal ligament at mid-inguinal point. In the figure, you can see the abdominal aorta bifurcating into 2 common iliac arteries. The common iliac artery again dividing into internal and external iliac arteries, and external iliac artery continuing as the femoral artery denoted in green color. Femoral artery, it is a chief artery of lower limb. It passes successively through femoral triangle, adductor canal and then enters popliteal fossa through adductor hiatus and continues as popliteal artery. Adductor hiatus എന്ന് പറയുന്നത് adductor magnusന്റെ അറ്റാച്ച്മെന്റിലുള്ള ഒരു ചെറിയ ഓപ്പണിംഗ് ആണ്. adductor canalലെ കണ്ടൻസ് popliteal fossയിലേക്ക് പോകുന്നത് ഈ hiatus വഴിയാണ്. In femoral triangle, femoral artery traverses from midpoint of its base to apex. At the base of the triangle, femoral artery lies lateral to the femoral vein, and at its apex, it lies anterior to the vein. In femoral triangle, femoral artery gives 3 superficial branches. They are superficial epigastric, superficial circumflex iliac, and superficial external pudendal arteries. The deep branches are profunda femoris and deep external pudendal artery. Profunda femoris, it is the largest branch of femoral artery. It gives rise to medial and lateral circumflex femoral arteries. In the figure on the left side, you can see that lateral circumflex femoral artery passes between anterior and posterior divisions of femoral nerve. Deep external pudendal artery passes medially deep to the spermatic cord or round ligament of uterus and supplies scrotum or labius major. Now we can study about femoral vein. Femoral artery യുടെ അതേ കോഴ്സ് തന്നെ ബാക്ക്വേർഡ് ആണ് femoral vein ൻ്റെത്. In the figure, you can see popliteal vein and popliteal fossa. Popliteal vein continues upwards and after passing through adductor hiatus, it becomes femoral vein. Then it passes through adductor canal and reaches the femoral triangle. In the femoral triangle, it lies medial to the femoral artery at the base and posterior to the femoral artery at the apex of the triangle. Femoral vein receives the following tributaries: great saphenous vein, which is the largest tributary, profunda femoris vein, medial and lateral circumflex femoral vein, deep external pudendal vein, and direct muscular tributaries. Superficial tributaries of femoral vein include superficial epigastric, superficial external pudendal, and superficial circumflex iliac veins. As you can see, femoral vein continues upwards behind inguinal ligament to form external iliac vein. Next we have the femoral nerve. Femoral nerve, it is a chief nerve of anterior compartment of thigh. You can see it passes lateral to femoral artery, it passes behind the inguinal ligament and divides into anterior and posterior divisions which are separated by lateral circumflex femoral artery. ഫിമറൽ നെർവിനെ കുറിച്ച് ഡീറ്റെയിൽ ആയിട്ട് പറയുകയാണെങ്കിൽ ഫിമറൽ നെർവ് ഇറ്റ് ഇസ് ദ ലാർജസ്റ്റ് ബ്രാഞ്ച് ഓഫ് ലംബാർ പ്ലെക്സസ്. ഇറ്റ് അറൈസസ് ഫ്രം ഡോസൽ ഡിവിഷൻ ഓഫ് ആൻറ്റീരിയർ പ്രൈമറി റാമൈ ഓഫ് L2, L3 ആൻഡ് L4 നെർവ്സ് ആൻഡ് ഡിവൈഡ്സ് ഇൻറ്റു ആൻറ്റീരിയർ ആൻഡ് പോസ്റ്റീരിയർ ഡിവിഷൻസ്. ആൻറ്റീരിയർ ഡിവിഷൻസിൽ നമുക്ക് ഒരു മസ്കുലർ ബ്രാഞ്ചും 2 ക്യൂട്ടീനിയസ് നെർവ്സും ആണ് ഉള്ളത്. ദി ക്യൂട്ടീനിയസ് നെർവ്സ് ആർ മീഡിയൽ ക്യൂട്ടീനിയസ് നെർവ് ഓഫ് thigh ആൻഡ് ഇന്റർമീഡിയറ്റ് ക്യൂട്ടീനിയസ് നെർവ് ഓഫ് thigh. And the muscular branch supplies the sertorius. Posterior division we have 1 cutaneous branch, that is the saphenous nerve, and 4 muscular branch to supply quadriceps femoris, that is the rectus femoris, vastus lateralis, vastus medialis and vastus intermedius. Next we have the femoral sheath. Femoral sheath is a funnel shaped facial sheath. It encloses upper 3 to 4 cm of the femoral vessels. Its anterior wall is formed by fascia transversalis and posterior wall is formed by fascia iliaca. Its apex merges with tunica adventitia of femoral vessels. In the figure, you can see that femoral sheath does not enclose femoral nerve. It encloses femoral vein, femoral artery, lymph node of Cloquet, and femoral branch of genitofemoral nerve. Femoral sheath is divided into 3 compartments. They are, first we have the medial compartment, which is relatively empty and is called femoral canal. It contains lymph node of Cloquet and fibrofatty tissue. Then we have the intermediate compartment containing femoral vein and lateral compartment containing femoral artery and femoral branch of genitofemoral nerve. ഇനി femoral triangle clinical correlation ആണ്. Main clinical correlation of femoral triangle is femoral hernia. It is a protrusion of abdominal contents, for example a loop of intestine through the femoral canal. This presents as a globular swelling infralateral to pubic tubercle below inguinal ligament. This is more common in females because femoral ring is larger in them due to greater width of pelvis. അങ്ങനെ നമ്മൾ femoral triangle ന്റെ ടോപ്പിക്സ് എല്ലാം കവർ ചെയ്തിരിക്കുന്നു. താങ്ക് യു.